Okay. So today, okay, just please don't make noise. Okay, today we'll see about school health programs. Okay.
Okay, sir.
So school health programs are mainly it is about things that how we incorporate the oral health or oral health related activities in school health curriculum. Okay, that is what this chapter is mainly about. We'll see about the past school health programs, what government has done for improving these children's health. Because when we improve their health, their future becomes better, which is normally the adult population. So first, we'll see the definition of health. So health is a state of complete physical, mental, and social well-being, and not merely absence of physical infirmity. So it is given by WHO. Okay. So here, what are the main aspects is that first we have to the first aspect is healthy appraisal of school children. So if you start from the beginning, everything starts with the school children. Then adults don't need so much importance because already their healthcare is taken care of. Second thing is whatever issues they have, we have to do the remedial measures and follow up. Then we have to prevent the disease that might come to them in future. Then we have to create a healthful school environment, provide the best nutritional services, and we have to give them emergency care also. Apart from this, we can associate with mental health and eye health, health education, then special care needs for special children, then school health records maintenance. So all these things we have to. So what is a normal requirement for school health program? So first, you should be administratively sound. You must be able to go and talk to a school, be able to convince the head of the institution or the parents or the teachers to join the program and help the school children's betterment of oral health. Then we have to be strong in providing health facts and health care. Then we should be able to convince these children from a worse attitude to a better attitude towards oral health. Then finally, improve your psychomotor skills and the students' psychomotor skills, like either in brushing or maintaining the oral health, maintaining plaque-free oral cavity, all these things. Then you have to start primary preventive programs. You must be strong in that. Then finally, you have to screen them and ensure treatment. So the advantages are very simple. First thing is when you do some sort of healthcare in school children. Okay, so in future there might not be any accumulation. Like if you start treating the decay in the earliest part of time, then you will save the teeth from either extraction or going for root canal or an invasive treatment rather than just preventing it with the pit and fissure sealant so that they don't get caries. So students can be assessed easily with this method. Then there is no it is easy to maintain their general health also. They'll be in daily contact with the health personnel so that that will become a habit for the children so that in future also they give priority to their oral health or general health. Then many expense like root canal, crown or extraction and replacement of teeth, those expenses can be reduced, and so it is cost effective. Apart from this, if it is more complicated procedure, the parent has to take leave, yeah, student has to take leave from school, so their normal activities will get affected. That can be prevented if it is just a preventive treatment or an early advanced diagnosis and treatment. Then it can be a work for community staff.
Okay,
Now,
sir.
okay. I think Talla went out. Okay, so these are the advantages. So, how will you integrate an oral health in a school health program? Okay, so when you give all these things like healthy school environment, school health education, school health services, nutrition and food services, physical education, mental health and health promotion, and school and community relationships and all. So if you impart all these things in the school health program, so how will you do this? We'll see the examples in past. Okay, so first healthy school environment. So for first healthy school environment, what you should do is The healthy school environment should be both physical and psychological also. Okay, so the student should feel healthy when he comes to school. School should be supportive for them. Okay. First thing is physical environment. So safe water, safe sanitation, then healthy dietary practices, then outside winter policy, all these things, healthy foods. Whatever they see, they should not have something which is bad for their health. Okay. So all these things are physical environment. Then psychological environment, supportive health promotion. Then teachers should be role models. They should inspire the students in oral health. Then peer reinforcement means the same batch. The students, like their friends, should be also influenced. So seeing their friends, they'll change. So peer reinforcement, all this. Okay. Then school health education. How will you provide school health education? Is we have studied health education chapter, right? Same. First, you have to develop your personal skill, then raise health consciousness to the children, then improve their understanding and healthy attitudes, then you promote the healthy behavior and reduce the risk of oral disease. Okay, so what you will cover in oral health education is first teeth, how do teeth function in the oral cavity, then what is dental plaque, what is dental decay, how is it formed, how will you prevent that, then how will you take care of your teeth daily, by how will you brush your teeth, how will you use your floss or whatever it is, how will you teach the children, then what you do in fluoride treatments and what is fluoride, how it is going to save their teeth and how we are going to provide them to the oral cavity, then about the nutrition, daily what all they should eat for the healthy living, and the priority of dental visits. So all these things you should be covered. Then for school health services, what you provide is first is screening. Screen all the oral cavity for children and provide appropriate treatment and preventive options. For this, you will have an option called referral. Okay, referral is what you do in our college. Okay, you refer them to the special environment or special department so that their treatment is going on. But here you have an option called blanket referral. Okay, what is blanket referral is like? For example, you do screening or diagnosis with the dental auxiliary or some other staff who does not have any dental facility in the school campus or in the education institution. In that case, what they'll do, they'll just screen and they'll find out the diagnosis. They'll write it in a small card and give it to the child or the parent and refer them to the nearest dentist. Okay, that dentist is going to do the treatment for the diagnosis. He is going to attach the card and give it back to the parent, and they'll come and give it back to the school. So this is called blanket referral. So they do this for providing treatment without the school being involved. So first we start school-based oral health program. What all we have done? First is toothbrushing program. We have done in third year. We have done uh, camp or this one, Balshankri.
Yes, sir.
You have done camp.
Yes, sir. Research பண்ணோம் sir.
Research. Okay. You have seen the students doing camp in your batch.
Yes, sir.
Uh, so that is what is first thing, toothbrushing program. So what they do is they assemble them in the first floor and then they will give them oral health education and brushing techniques. No, so that is what is
Yes, sir.
called toothbrushing program. So at a time we'll cover 6 to 8 children and we'll make them sit or stand around you. You will teach them with the 3D model how to brush their teeth with a 45-degree angulation, provide a vibratory stroke, and how to clean all their surface of it. So with this, you are going to teach them brushing technique, okay, and make sure that all
Yes.
surface brush. So this is first school health program, school-based oral health program. So based on this, IAPHD has decided 7th November as National Toothbrushing Day. Okay. Then fluoride mouth rinse program. Now toothbrushing is done. Now they have to follow that at home. Now at school premises, what you can do is you can give them a fluoride mouth rinse program. How you can give is you have to take 0.2% of sodium fluoride and dissolve it in 1500 ml tap water. Okay, so each 10 ml will give you 9 milligrams of sodium fluoride. Okay, so what you do is you take this 10 ml in a dispensing cup like in the picture. Okay, and you provide that to the children. So what they'll do is they'll rinse their mouth, okay, and spit it back to the cup, and they'll use the tissue to wipe their mouth and put it back in the cup. So that tissue will absorb the uh, waste mouth rinse, and they will have to just dispose the tissue and cup. Okay, so this rinse is to
Okay,
be
sir.
advised for 60 seconds. So this you can do in a classroom-based environment. You can teach children how to rinse their mouth, spit it back, then use a tissue, wipe their mouth, and put it back in the cup, and the tissue will absorb the waste mouth rinse. Okay. Um, so here they have to know how to switch the solution between their oral cavities, teeth, tongue, and they should not swallow the solution. That is the main priority. Okay. The next thing is fluoride tablet program. In fluoride tablet program, the same 2.2 mg sodium fluoride tablet is given. What they have to do is they have to chew and they have to swish and swallow the tablet. Okay, swish in the oral cavity and follow. So this is called swish and swallow technique. Okay, so with this tablet, they are going to when you do it weekly once, it will be a better option for prevention of dengue caries. Then what we can do is provide school water fluoridation. So that the student who is consuming school water daily on daily basis will be provided with fluoride supplements. So how we will provide is normal optimum level of fluoride for water. You should only add 1 ppm parts per million. Okay. So for per million water droplets, you have to add only million grams of water. You have to add only 1 part fluoride. Okay. So 1 ppm of fluoride for every water is optimum level of fluoride. But for school water fluoridation, you have to add 4.5 times the optimum concentration. That is 4.5 times. That is 4.5 ppm. So why that much is because the water that is consumed is maybe they consume maximum of half liter to 1 liter per liters. Okay. So in that gap, only that much they are going to consume, and the fluid of optimum the if we give only 1 ppm, that will be really less for them. If they consume it on a daily basis, like if they have home water or the water which they consume daily at home, at school, everywhere, if it is going to be water, fluoride water supply, then 1 ppm is optimal. But only at school, you have to give them 4.5 ppm. The only disadvantage is that they should not have fluorosis. If it is already a fluorosis endemic area, then it is difficult to provide community water fluoridation. Okay,
Okay, sir.
these are some examples. I'll just skip it off. Then school-based sealant programs. You have done the sealant, no? For quota, you can use the sealants. Chakri, have you done that?
Hello, yes, sir.
You have done sealant, right? So, how will
Yes,
you
sir.
choose a patient for sealant program? How will you say whether this student can be given sealant, this student cannot?
This student should be newly adapted teeth should be there, and DK shouldn't be there, so for the sealant application.
So you will apply for shallow pits.
Sir,
You will apply for shallow pits.
no, sir. Only for deep fit and fishes, sir.
So the first criteria is it should be newly erupted within 4 years of eruption. Okay. If it is beyond the
Yes, sir.
fourth year of eruption, then it is absolutely normal. So it should be within 4 years. Then it should have deep pits and fissures. And if it is having deep pits and fissures, it should be free of caries, either closal or proximity. Both it should be free of both the caries. Okay. When all these things are
Yes,
present, then you give them a seal. Okay. So you have to choose the population for sealant application and provide them with sealant.
yes, sir.
Okay. Mm. Next is nutritional program. Till now we saw school-based oral health program. Okay. Now nutritional program, school-based nutrition program. You have heard of this midday meal scheme, right? So here midday meal scheme, what they do is they provide food for children during afternoons, and approximately 12.5 lakh, 12.6 lakhs to schools are there under the scheme. So here what they do is central government is going to sponsor 75% and the state government is going to sponsor 25%. And in this midday meal scheme, they have to impart all these food items. So it should have, for primary school children should have 450 calories, and upper primary it should have 700 calories. So they should have this much amount of proteins, rice, dal, vegetables, and oils for both primary and upper primary. Okay. When they give this optimum quantity of food, then the child will meet its daily needs of calories and required quantity of proteins and minerals and carbohydrates. So first in 1925 it was started midday meal scheme by Madras Corporation. Okay. So after that in 1980s it was started in Gujarat, Kerala, Tamil Nadu, and entire Pondicherry also. Okay, finally, 19 after 10 years, 1990s to 1991, it was transferred to about many number of states, like approximately 12 states to 15 states. Okay. Then what is the advantage is that first there were no loss of attendance because they give food. Child doesn't take leave because they cannot skip the meal, which is given for free. Second thing is it reduced dropouts. Those who didn't want to study also they came to school for food due to food. Okay. The third thing is the child also benefited by proper nutrition at least for once daily. Okay. So the thing is this meal should supply one third of the total energy requirement for the child. So whatever he daily consumes, in that one third of the energy should be given by this meal, and it should be only a supplement to the diet and not a substitute for home diet. Okay. So those who are able to bring their home diet, they don't have to take this diet. Okay. So these are the amounts of food. Now we see about specific programs what they have done in the past. Okay, in other countries,
Yes,
in
sir.
other states, and how they have done school-based program and how they have improved the oral health of school children. So first is learning about your oral health. So this was done by American Dental Association in 1971. So in this study, what they did is uh, they just took all the preschool, primary, and secondary school. Okay, so all these students were involved in this program, and they gave them more priority and more importance to the preventive dentistry part of school health curriculum. Okay, so how to prevent dental caries, how to prevent plaque accumulation, how to prevent gingivitis. So all prevention programs were educated to the school children. Okay, so first priority is to give them an effective control of plaque control knowledge and skill. Okay, second thing what they considered is proper and effective knowledge about diet and dental health. Okay. Then third thing what they emphasized is the harmfulness caused by sugar and starch in their diet. Okay, so all these three were covered in their program, and they divided the school children into 5 levels. First is preschool level, which is too young. Then level one, which is called grade three. Then level two is 4 to 6. And level three is 7 to 9, and level four is 10 to 12. So these grades were involved, and they started giving them self-contained teaching packet. So this packet contains all these things. What is first the teacher's self-contained guide, which will have dental facts regarding which the teacher has to teach these children. The second thing is glossary, which will impart the meanings of ununderstood words in dental field. Okay. Then third one is a curriculum guide. So what they have to cover for every month or every term, so that will be given in curriculum guide. Then finally lesson plan for all the preschool level to all the four levels students. Okay. Then finally they'll have tasting competitions, then oral transparencies, and finally they'll also have activities for parents at home. So all these things were given to the teachers. So this is regarding learning about your oral. Now next program is Tattle Tooth program. So Tattle Tooth program is also called Tattle Tooth Texas Statewide Preventive Dentistry Program. Okay. So Tattle Tooth program was started from 1974 to 1976 at Texas. Okay. So these agencies were involved in Tattle Tooth program. One is Texas Dental Health Professional Organization, Texas Education Agencies, and Texas Department of Health. These three so agencies and organizations joined together and started the Title Tooth program. First in 74, they started it as pilot version. Then they renamed it as Title Tooth 2 and started in 1975. So it was 2 year program. In this, what they did is they have to cover all the children in Texas. That was the aim. So they involved all the school children in Texas, and they included the oral health program in their curriculum. So first, in learning about oral health, we saw about the guides and all they're giving. So here, what they did is they started providing with videotapes. Apart from lesson plans, here they started giving videotapes. So they mainly gave 3 videotapes. First videotape is it teaches the teachers regarding the lesson format and content, what they have to teach. Okay. Second videotape is totally about brushing and flossing. So that brushing and flossing will be like training both the teacher and also giving their teaching them regarding how to instruct the student to brush their teeth. Then the third videotape is about extra background information apart from brushing and flossing. Okay, so these 3 videotapes are given to the school organization, and the teacher used to go through all these 3 videotapes and include oral health in the curriculum. So this was far better, and they started releasing 2 newspaper release. One is for parents, and the other thing is for their own scientific publication. So they did 2 newspaper releases. So this is about Title Tooth program. Then comes your North Carolina statewide preventive dental health program. So see, these are all our essays. Okay. So when they ask for school health program, you have to write all these programs. So first they did North Carolina Dental Society program in 1970. Okay. So this mainly involved school and community water fluoridation, fluoride treatments for children, and preventive education for dental children, and plaque control education for school children. So this was a statewide program and 10-year program. So they did around the North Carolina state for about 10 years, the study. So 1973, Frank E. Law started this program. Okay, so the main objectives regarding fluorides, health education to schools and communities, and make the public health staff easily available. So all these 3 were the main aims. So first they implemented in 130 rural areas. They started fluoride supplementation in 130 rural areas. Then they started fluoride mouth rinse programs for 4 lakh students, and they started screening and referral for also 4 lakh students. Then they gave a dental health education, the SEALANT application. All these things were done for as a key product of this educational program. Then comes your Teenage Health Education Teaching Assistance Program. This is also called TETA program, THETA, TETA program. So the concept behind this program is we are going to teach the high school children and they are going to teach the primary school children. So that is the concept. So teenage is going to assist us in health education. That is what the name suggests, Teenage Health Education Teaching Assistance. So we are going to teach the high school children and they are going to teach the preventive dentistry to school children. So what will happen is they both will have a good rapport and exchange of knowledge. Second thing is both will be benefited, both will understand each other, and both will also understand the oral health importance. And finally, the high school children can also get inspired for their career opportunities toward dentistry. So these 3 were the goals. Then next last program is ASCO Dental program. Okay. This was done in Denmark, Danish population. Okay. So it was done in 1943 to 46. So it was the first program they started. So this was also a 10-year program. Okay. This is because in that population, the caries was very high. Okay. So they made initial surveys regarding this high dental caries, and then they started this program. In this program, they started community water fluoridation, and they started providing them with 5 dentists from nearby communities for each group or each part of the state. Okay, and these dentists will start providing topical fluoride treatments. So at the 10-year period, after the 10-year period, what they revealed is there were 28% reduction in DC in 3 to 5 year old, 34% reduction in 6 to 12 year old, and 14% reduction in 13 to 17 years old. So they achieved whatever they aimed for. So next thing is Head Start's preschool health program. This is nothing but it was started by US in among the low income population of their country. Okay, mainly to they mainly concentrated on children because that is more easier than to treat adult with complicated procedure. So they started as a Head Start among children. So this also what happened is based on this also they had a better rapport with the parents and they had a better family relationships, and the child was physically stable, physically more supportive, and he was able to maintain the practice of visiting dentist. Then Shark School Health Additional Referral Program. This was nothing but they started referring their school children to dentists regularly. Okay, that is what we do in India right now because other programs are not that much implemented. So we have started an additional referral program. So we are going to screen and refer them to a dentist for effective utilization. And apart from this, one person will be appointed by the school to take care. In school, they are going to be taking care with the parents and the students on one-to-one basis. They'll meet directly, take an interview, they can history, and screen them and do that. Whereas in when the parents are at home or the student is at home, then they contact through phone and they communicate regarding their oral health practices. Then the last thing is Colgate Bright Smiles and Bright Future. So this was sponsored by Colgate, and they have sponsored over 80 countries here in India. Sorry, 80 countries in the world, and they have covered more than half a billion of children. So that much children they have covered. Their main aim is to provide first oral hygiene kit. They provide free oral hygiene kit to all these children what they are screening, and main aim is to screen their oral cavity and give them a proper diagnosis and provide them oral health education. This was their main aim, and they provided an oral health kit for the children. This was successful in many countries. India was also one of the country, and this was supported by IDA in India, Indian Dental Association. So finally, why do we do all the school health program in schools? Why do we give priority to school health program than the adult program is? uh, mainly the mainly to achieve the incremental dental care. So what do you mean by incremental dental care is periodic. See, this first line is the definition. Periodic care so space that increments of early diseases are treated at the earliest time, consistent with proper diagnosis and operating efficiency in such a way that there is no accumulation of early disease beyond the mean. So what this means is that uh, when you start treating dental caries or dental oral hygiene problems or gingivitis or whatever issue at an earlier stage, okay, then what happens is we prevent many complicated procedures in future. Further, we also prevent accumulation of diseases. Like once a dental caries is accumulated, it goes for root canal. Once a gingivitis is accumulated, it goes for periodontitis. So when accumulation of dental teeth starts, the disease becomes more complex and more complicated and more expensive. So incremental dental care is what is that we are going to call the student in between or in the due course of his schooling, okay, like every 6 months or every 1 year or once, and we are going to treat him or diagnose and treat him with the proper uh, care. So what happens is he'll not have any bigger problems in his oral cavity. Second thing is he'll have proper influence towards dentistry. Like he'll come regularly for dental visit. Okay, so he'll have that habit from the childhood itself. So even when he's adult, he'll come properly for dental visits. Okay, then if he's not having funds or anything, it will be a very advantageous question for him because we are going to do everything in a cheaper basis because she doesn't need any complex treatments, only preventive and treatments which is that is necessary, like fillings or scaling or something which is very cheap. So all these things are advantages. So first advantage is tooth loss is prevented, pulpal involvement is prevented. Second thing is it is economic. Third thing is periodontal disease can be detected at an early age. Then preventive programs can be done on a periodic basis. Then it can cause small increments when it will reduce loss of teeth. Then last thing is you'll get a habit of coming to dentist periodically. Whereas the disadvantage is that when there are more students, like if you're going to cover an entire school, the students will be more, and it is going to be time consuming for you to start filling tooth for each and every children. And when you finish the last child, again the first child will have a problem. So it keeps on circulating, and you will not have a time for uh, proper oral health providing provision. Okay. Then second thing is financial resources. So even though it is cheap, you cannot start affording to pay a school population regarding your financial supplements. All the drape or all the gloves or whatever you're going to use for treatment is going to be costed, and that cannot be exhausted by us. So some support from the government side should be present. Then third thing is like the child might get dropped out, or the child might not get interested or get scared of dentist, or he may not come for the next visit. So in that case, this incremental dental care will be a failure. So generally, what are the barriers of school health program? There are only three barriers. One thing is the acceptance and understanding will be very difficult. Second thing, we cannot be able to collaborate with many funding organizations. Then third one is there might be any flaws in strategic planning. So these are the three. Okay. So do you have any doubts in this
Yes, sir.
program? Okay. Do you have any doubts now?
No, sir. No, sir.
Okay.
Yes, sir.